Welcome back. We have Dr. Swiner with Durham Family Medicine here today. And this has been like the worst flu season like ever. That's what I'm hearing. And
like it.
I'm actually a hologram. I'm not here because I'm not leaving the house. But let's talk about the flu. I mean, is it the news? I mean, it seems very, very scary. A lot of people are talking about it, and a lot of people are very worried.
Yeah, I mean, it's worrisome. I mean, it's been we've had very high rates of flu, unfortunately, this year. We've had new strains that have popped up, particularly H3N2, you know, if you're familiar with H1N1 that we talked about a couple of years ago. It's become, you know, and definitely a national issue.
I've also read that the vaccine itself, and maybe you can explain a little bit about this, because they have to kind of guess somewhat to make the vaccine, and maybe they didn't guess right this time and it isn't quite as effective. What do you say to the folks who may not have gotten the vaccine right now, and is that true?
So most flu vaccines of the current year are based upon predictions from the previous year. So the medical community, the labs that do the testing that make the flu shot try their best to predict based on the previous year's numbers what is to come. You can imagine how hard that could be.
Sure.
So, you know, the rumor, and I think, you know, we're hoping that the evidence will show something different, but the number that's being thrown out right now for efficacy of this current flu shot is about 10%-ish in its, you know, effectiveness for preventing the flu. What I discuss with my patients is that I would still rather be protected 10% than 0, particularly with having young kids that are in school at home. And, you know, thankfully, knock on wood, no one in my family has been affected.
Well, you have a wooden wood too.
I do, wood.
Oh,
no one in my household has been affected as of yet, hopefully not. And we generally do not ever get afflicted by the flu because we do religiously get our flu shots every year.
Well, just as a personal anecdote, last year I didn't. I was the only one in the family who didn't take the vaccine, and I was the only one who came down with the flu. But this stuff is kind of scary. What can folks expect from this flu this year? Because what we're hearing in the media is it's bad, and it has killed some folks.
It has, and unfortunately, about 30 or more children unfortunately have succumbed to the disease. I mean, you do the best you can. So what I try to do, and what I try to personally practice and to tell my patients to do is still get the flu shot. It's not too late. The flu season lasts until May-ish. So there's still time, thankfully, to get the flu shot if you haven't. If you are older than 65, there's a higher dose because that population is at higher risk of getting the flu and having complications from the flu. If you are pregnant or a breastfeeding mother of a baby that's too young to get the flu shot, then you should definitely get the flu shot, both to protect you and your baby, but also because if baby can't get the flu shot, it's too young, meaning younger than 6 months, some antibodies can pass through your breast milk and can protect your baby. So that's very important. And then, you know, washing hands, sanitizing, trying to be as smart as possible. Another thing that I try to do when I get home is, you know, because I see sick patients all day long, I try to get home and change my clothes immediately so that we're not bringing germs into the household. My kids, you know, as soon as they walk in the door, we wash hands, you know, so that we're trying not to bring outside germs into the home and, you know, do the best you can.
That's good advice. I've always wanted to ask a doctor, why do you stay healthy? Because you're seeing the sick people all the time. The young kids particularly, and I think a lot of parents probably can relate to this, is, you know, we've seen in the news where they develop respiratory issues with the flu. Is this common with flu, or is this particular flu really playing havoc with the lungs of the individuals who get the flu?
I mean, I think it's presenting in its typical form, even though it is of a different strain and comes in different varieties. I think the patient that gets sick with the flu kind of presents in a typical way. Really high fevers that won't go away. Lots of fatigue and achiness. I mean, literally feeling like you've been hit by a truck. And that's what, you know, you can almost see a flu patient a mile away just from the looks of them. I mean, literally look like they've been run over. But high fever, achiness all over the body, really significant fatigue and malaise, nausea, vomiting, diarrhea, generally without a cough. I mean, you can have cough, but that's usually a cardinal symptom, is to be absent of a cough and have all the other stuff going on as far as the flu is concerned.
So treatment for the flu, I've heard Tamiflu, but I've also heard that's only effective in the first 2 days or something like that. What's the truth behind that?
So it is true.
It is.
Yes, so Tamiflu is the most popular. There's another antiviral that's often used a little bit more frequently, but it depends on type A versus type B. And the flu strain that we're seeing more often this year is type B. The shot seemed to cover a little bit more on type A side, but again, you try the best that you can, and Tamiflu is probably the most popular, most widely used medicine. And then supportive care. So quarantining yourself, kind of staying in the back room. And
please don't go to work.
No, don't go to work.
Don't send
go
your
to
kids
school.
to daycare and school. Please don't do that.
No, even though I know that's a hard thing to do for working parents. But yes, keep them at home. Lots of fluids, lots and lots and lots of fluids, because these people are at risk of becoming dehydrated. Chicken noodle soup, orange juice, the usual stuff to build up their immune system. And just a lot of hand washing and Lysoling and wiping down the house once someone catches the flu.
How long do the symptoms last then? I mean, what can you expect once you catch the flu? How long before you start feeling better?
Generally about a week. If you haven't been able to get Tamiflu and be on the medication, it's probably about 7 to 10 days. If you are able to get the medication, especially within the first 2 to 3 days, hopefully you can shave off about three-ish days off of the duration of being ill. But without the flu shot or without Tamiflu, you're probably going to, have to be away for about 7 to 10 days.
So it's important there when you're feeling these first symptoms to go see someone, because Tamiflu, that's a prescription, isn't it?
Yes, it is.
So you need to get it, and you need to get it right away.
Correct.
All right. Well, that's the flu. We didn't get to the crud. I had that, but
I did too.
I survived that.
Me too. Good.
I think a lot of the same precautions apply. We're visiting with the doctor. We have much more to talk about. We're talking about illnesses, but more importantly, how to stay healthy. So stick around. We'll be right back.